I would like to introduce today's speakers. Sarah Goodwin is a policy analyst with National Center for Healthy Housing. Sarah coordinates the National Safe and Healthy Housing and activities including federal policy, housing codes, and technical assistance for cities and localities. And Andy, he is the program director for Rural LISC. Andy is responsible for field program activities. From 2001 to 2014, Andy was with LISC Mid-South Delta program, where he headed the Delta Home Ownership Initiative. LISC HUD and USDA Rural Development funded programs and LISC Sustainable Communities Initiative in the Delta. Andy has 26 years of administering grants and technical assistance to community development corporations engaging in housing development, financial independence, workforce development, and homebuyer education. Today we would also like to highlight 3 organizations that participate in Rural LISC Healthy Housing Projects. Community Development Corporation of South Berkshire, which is located in Great Barrington, Massachusetts, and that's with Tim Geller. Also, we would like to highlight Northeast Community Action Corporation, which is located in Bowling Green, Missouri. Carla Pott is the Deputy Director for the Housing Development for Northeast Community Action Corporation. This organization is the largest community action agency in Missouri, serving 12 core counties, rural and urban. We'd also like to highlight Human Resource Development Council 9, located in Bozeman, Montana. Lila Fleishman is the Housing and Healthcare Coordinator in the Community Development Department at HRDC 9 in Bozeman, Montana. Lila leads HRDC's Healthy Housing Initiative and works all along with the housing continuum from homelessness to home ownership. At this time, we would like to start the presentation with Andy.
Good afternoon. I have to forgive my voice. I'm a little bit groggy, but I'm drinking tea and trying to do better. It's an honor to be here. First thing I wanted to do was I wanted to thank Tim Geller from CDC South Berkshire. In between the time that we started and today, he's actually no longer the director. But he gave us some slides, and Vicky's going to go through them, and I promised him I'd thank him because he put in some hard work towards helping us out here. Let me tell you a little bit about LISC and our healthy housing program and what we do before we get to the experts. We believe in rural America at LISC. We work with and through grassroots partners in rural communities and regions. We're a connector, cross-pollinator to our partners, linking them to national opportunities in each other and aggregating resources that they may not access without our network. The rural landscape, about 20% of our country's population resides in rural America, so that's 60 million people who live and work in rural communities. So from a standpoint of being competitive, we have to leverage that talent and those assets of the part of the nation that's rural. So as of 2020, we've created about 380 million in total development, working with a network of 89 partners across 45 states and Puerto Rico. That allows us to bring scale to rural investments and outcomes. This year actually, in 2020, we started our Rural Promise. We're trying to elevate our impact in rural America by 20%. We have a goal of 20% of our work being rural, our grants, our loans, possibly eventually our tax credit equity. We want 20% of what we do, and you'll start to see that in some of our programs. If you follow our website, you may have noticed a large grant we recently received from Lowe's, where a large chunk, about $25 million, is going to be for rural small business assistance. And our particular work is especially helped with HUD Section 4 funds. So the day-to-day work of program directors and program officers like myself are similar to HAC, one-on-one services, training, TA, requested by our CDC members, helping them with packaging and securing financing for housing community facilities. We do some intensive help with some groups operating in disaster areas, assistance with other special challenges, including hands-on assistance to groups working in persistent poverty areas. Trainings, we do an annual rural seminar for our member groups, 1 year in DC, 1 year away in the field, and some selected webinars and trainings on topics in consultation with our CDC members. We work to bridge a communication divide with information on relevant initiatives, financing, training opportunities, and forms of data. We have a rural LISC news which goes out once a month, sometimes twice a month. That's very informative and helpful to the field. Some of our programmatic priorities. I mean, we have several programs housed within rural LISC and within the rural LISC, the rural division of LISC, and then trying to bring several of our national programs to rural as best as we can. But generally, they're involved around capacity building, catalyzing economic development, small business development. LISC has a small business lending arm named Amito, district development, disaster recovery. We're currently involved in some of the significant disaster recovery with housing rehab around the Gulf, outside of the Houston area. Several housing initiatives, farm market housing initiative in the Northwest. Lending initiatives, we offer small recoverable grants to our members for pre-development. We're able to do pre-development loans, construction loans, mini permanent loans. Native American initiative, we recently did some work around manufactured housing. We're currently working on setting up some webinars around culturally appropriate housing, doing some work to assist an initiative in South Dakota, and planning an event and gathering at our seminar, which will be scheduled for June of next year. And then I mentioned the rural e-news previously. Our LISC Healthy Housing Grants, we've been making these small grants around $15,000 available to our partners, and it's been funded primarily through some of our government funds, Wells Fargo, and some great funding from Wells Fargo, which has given us about $200,000 a year over the last 4 years, so pretty much double our efforts in the field. And we've been using it broadly, just because it's important to get our member groups involved in this space and thinking more about healthy housing and bringing more healthy housing practices and green practices, to their work. So generally supporting new construction, rehab, manufactured housing, housing counseling, providing healthy environments. But it has been broad. Vicki and I went through a list of dozens of our previous grants over the 5 years, and then we fought with 3 good ones for some geographic diversity. But we have funded some things with supporting staff involved in establishing walking trails for health, playgrounds for health, instituting different kinds of classes to educate residents on health, instituting no smoking programs. It has run a broad gamut. And again, the reason for this is one of the things that is big now is that healthcare funders are seeing the importance of housing as a social determinant of health. So this has been a way for us to start getting into that space. And it's been an issue, and it's been a concern for LISC as a whole. We've had some success in attracting healthcare funding to support some of our financial opportunity center work, because they realize the importance of working with families, with counseling and social services. It has been instrumental in even opening up one of our new field offices in Hampton Roads, Virginia, because of healthcare funding. We have division at LISC that focuses on healthcare facility financing. We have a division at LISC that focuses on health financing. Something interesting that has happened there is some emerging health grants, which one of them went to one of our rural LISC members to look at what we can do with housing design in terms of improving health outcomes. And some of that work has looked into how housing groups, how CDCs like yours have been able to work with people to work on the asset management side to be able to track health and to be able to track health outcomes. So for a webinar like this, an organization like HAC, which is just preeminent in working with emerging groups, we want to give you a taste of this issue and the possible opportunities that exist for you being more involved in that space and thinking about some folks you may not necessarily think about with on healthcare as possible supporters of your work. So with that, get back to this. My mouse is acting up. I apologize. Let me get to the next slide and introduce Sarah Goodwin, the policy analyst for the National Center for Healthy Housing. Thank you.
Great. Well, thank you, Andy, and thanks to HAC for having me on today. I'm really excited to be part of this conversation. The National Center for Healthy Housing is a national nonprofit. We're based in Columbia, Maryland, and we combine research, programmatic work, and advocacy under one roof. So today I'm going to cover some healthy housing basics. I called this slide Healthy Housing 101 just as a super brief overview of how housing impacts health and what levers we see available for improving housing quality. So to start with, why does housing matter? Well, we know from the National Human Activity Pattern Survey that Americans spend about 70% of their time on average in their home environments, and this number can be even greater for certain vulnerable populations like the very young, the very elderly, or disabled residents. And housing isn't just significant for health because we spend a lot of time there, but also because there are many interrelated facets of housing that all work together to influence a resident's health and well-being. So that includes location, affordability, demographics, and quality, all of which are super important and all of which could have like an entire 2-hour webinar about them. But our focus and emphasis at the National Center for Healthy Housing is primarily on housing quality aspects of these facets. So when we look at how housing impacts health, we can look at specific conditions including chemical exposure like lead or radon, biological exposures like mold or pests, and physical hazards like structural issues that cause fall hazards or electrical hazards that are a fire risk or ventilation issues, as well as other conditions. And these housing conditions can all lead to a variety of health conditions, including some of the ones on the screen here. Also important to keep in mind here is that disparities in housing can exacerbate disparities in health outcomes. So, for example, if you have housing that's full of mold or cockroaches, it can make it impossible to control your asthma, even if otherwise you're doing everything right in terms of trying to control your asthma or following medical advice. So the housing conditions that you're living in can exacerbate health disparities and health outcomes. Also important to mention here that's not listed on this slide are other quality of life outcomes like attendance at school or work or school performance can also be affected by housing quality, even if it's not showing up in a particular health condition. This is just one example of how these relationships can kind of show up in data. So this is done out of work in Cincinnati, Ohio. So in this map, the density of asthma-related housing code violations are represented by the black dots, and the asthma-related emergency department visits by census tract are colored here, and the red and purple areas are the higher burdened areas. And you can see that the higher number of housing code violations tend to co-occur in places where the burden of asthma, as reflected in the emergency department visits, they co-occur in the same places. And this is just one example of how can have something that's measured as a housing quality issue in the housing code violations, and also have it show up in, from the medical side and from the health side in this strain on the medical system. So how big is the problem nationally? Well, we estimate that about 35 million, or about 40% of U.S. homes have at least one health or safety hazard, and often, homes can have more than one as well. This data, I think, comes from the American Housing Survey. These are just some examples of how we, measure specific health issues that are linked to housing quality. I'm not going to go through all of these right now, but they're just some examples of the really large impacts that we can see on folks across the nation as measured in health outcomes that are linked to housing quality. So what can we do about it? Well, this group of four buckets kind of illustrates how we think about the levers that are available to confront these issues at NCHH. We kind of think about these 4 buckets, and part of the reason they're laid out this way, or I wanted to present them this way, is that they emphasize really how broad the Healthy Housing Coalition and audience and stakeholders really is. Everyone who touches housing has a role to play in ensuring housing quality, whether that's from a legislative side or from a management side, or just as a resident living in your own home. So these are the examples on the screen here are just some examples, kind of just a handful of examples in each bucket. But the first bucket being housing regulation, that can be at the federal level with really broad sweeping regulations or legislation passed by Congress or enforced by the administration. At the state and local level, housing regulations that come into play for housing quality might be housing and property maintenance codes or permitting processes. The second bucket we consider is like the inexpensive repairs bucket, so that's things that repaired directly in the home, things like maybe fixing a plumbing leak, which could lead to moisture, or installing and repairing exhaust fans, which improves ventilation in the unit. That kind of goes along with the third bucket we have here, which is ongoing maintenance. So, things that are kind of obvious, like, smoke and carbon monoxide detectors, but also, routine maintenance to check for pests, inspect vents, look for peeling paint, keep an eye on, other emerging hazards to, try and reduce hazards or reduce exposures in the home. And then finally, the fourth bucket would be the small behavior changes, things that, that can both be managed, but also are, things that people can do in their own homes to try and, make them safer and healthier. And that can be things like using safe cleaning methods or using exhaust fans to reduce moisture and increase ventilation. So again, these are just some examples that I put up here to demonstrate the point that this is that healthy housing, is a really broad spectrum of different levers that are available to improve housing quality. It's not just something that one group should be working on or that can be fixed by one mechanism. So if you're interested in going further into any particular aspect of healthy housing, I wanted to highlight this particular section of our website, which is our resource library, because it's sorted into these different buckets. You can see like policy or data or standards and assessments. So if there's a particular aspect of healthy housing that you're interested in going into further, this would be a place I'd recommend starting, because it collects a ton of different resources and publications, both from NCHH and then from our partners or from other expert sources. A couple of specific tools and resources that I wanted to highlight here. From NCHH, we have a Healthy Homes Maintenance Checklist, which kind of goes further into some of the examples I was just talking about before, and goes along with the second document called Costs for Creating a Healthy Home that provides estimates or averages of costs for some of those routine maintenance items as a place to start for thinking about improving housing quality in individual buildings or units. I would also point folks to HUD and to the Healthy Homes Training Center that they run there, which has a lot of materials and trainings available if you were interested in going further into healthy housing. And then finally, just to touch on how healthy housing and COVID how COVID has come up in healthy housing, we've been doing a lot of kind of listening to and speaking to partners on the state and local level over the past several months, and kind of just cataloging and trying to respond to the effects and needs that we've seen bubble up, especially from the state and local level. So these are just some of the biggest concerns that we're hearing. But one example being that many services that take place in the home, like home visiting or home inspections, have had to pause or have moved to virtual platforms, which bring their own, challenges and limitations. Lots of local governments have had to shift to focus on emergency response, especially if you have like a healthy homes program that's located in the health department. Folks may have been pulled off of that and onto like contact tracing or other emergency response work. People are spending more time at home in potentially hazardous conditions. We've heard from a lot of partners at the local level who are looking for resources, and information about how to message to people about, while you're staying safe at home to reduce your exposure to the virus, here's the things you should be looking out for in your home to make sure that there's not hazardous conditions there. Also, we've seen concerns about safe cleaning and disinfecting, and just making sure that as people are using cleaning and disinfecting products more, they're doing so in a safe way. And then finally, we've heard concerns and questions about property managers and others who do have to routinely enter homes and how they can do so in a way that's safe for both them and for residents. So we don't have all the answers to many of these questions. It's an evolving area, but we've been cataloging resources and information that people are putting out on the website that's linked on this slide. And we'll continue to do so as we kind of continue to listen to and hear from folks who are working, directly in communities and providing those direct services about what the biggest needs that they're seeing are for dealing with this challenge. So that's it for me. So I'll hand it over to the next
Thank
speaker.
you, Sarah. That was some really good information from Sarah and from Andy. And at this point, we're going to shift into highlighting the organizations. The first organization that we're highlighting is Tim Geller's organization that he's done work on these slides for us, and he is with Community Development Corporation of South Berkshire. This gives a little bit of his information of the location of the organization. This slide shows a property that was developed with 45 units. Its location was within public transportation, shopping areas, and it also was energy efficient. The health was taken into account as far as making sure that they had the carpet and the flooring and the circulation going on, and also the universal access for the special populations were integrated into this facility. This is more detailed of the double walls, the blown-in insulation, cellulose, and the triple glazed windows that they were able to install in this complex. Just a little bit of an overview of that. This looks to be another facility that they were able to do, and it was a 49-unit facility. It was on 2 acres, and it also had a location that was walkable for jobs and for transportation. They also were able to do energy efficiency, health, and universal access for populations were also integrated into this complex. This was also located in Great Barrington, Massachusetts. Now we will transition into Carla Pott.
Good afternoon. Thank you for asking me to be a part of this and to share what we're doing with Healthy Homes. As Vicki said, we're the Community Action Agency in Northeast Missouri, and you can see our map and the counties that we cover, some very rural counties and some urban counties. Our program, and I'm going to tell you what we've done, how we've utilized rural LISC funds, for which we're very grateful, and how we've coupled it with our weatherization program. And then I'm going to talk to you about the so what. It's always important to know that what we do is important and matters to the people we serve. So we leverage our rural LISC funding with our weatherization program, which is, of course, the Department of Energy weatherization program. We also have many other rehab programs. We have housing preservation through USDA Rural Development, and we have two programs through our State Housing Finance Agency that utilize home dollars and also utilize some trust fund dollars that the state of Missouri has. Every home we do a weatherization energy audit, but we also do a healthy homes audit. So we look at how to make the home more energy efficient, but how to make it healthier. From those audits, we determine our scope of work. Once our scope of work is determined, not only to make it energy efficient, but to make it healthier, I always say we have spent a lifetime trying to make homes more energy efficient, and we should, but we also need to look at that our homes can make us sick and what we can do to make our homes healthier. We then look at our rural LISC funding, and then we look at what we're going to leverage to improve the homes. With our funding, our last funding, we completed 28 homes throughout our area. And then I'm going to tell you the so what. I heard sometime that people in the nonprofit world were great at telling stories. We may not have as many statistics, but we have both. We have statistics and we have stories. And I've been working with some other people, and they said maybe we need some more of the stories and we need more of the statistics, but we do both. So one of our lives impacted, our client had COPD. They lived in an older home. And this is the work we did. Now, it took a lot of leveraging dollars to do all this, but we did mold remediation. We put a new roof on the home. We did mechanical ventilation, how important that is to let fresh air into the home. And the client said, my health has improved since you did the work. I haven't been to the emergency room since because of my breathing issues. Saves money, but it also saves a lot of that person stress in their lives by having difficulty breathing and having to practice emergency room health care. Another story, we had an elderly couple. They had many health issues, and COPD is one of them. We see a lot of COPD. We see a lot of asthma. We did mechanical ventilation. You'll find that's a common thread through what we do. We replaced the heating and cooling system. We replaced windows and doors. They said they found it so much easier to breathe because of the work we did. And I think this is the final story. We had an elderly woman living alone, had lots of health issues. She was selling her possessions in order to have enough food, to be able to have food in her house. The not having proper nutrition just exacerbated her health issues. We replaced her heating cooling system because of a cracked heat exchanger. We did insulation. We did windows and doors. Her health improved. She didn't have transportation. We found a food pantry that would deliver food to her. So we looked not only at the housing issues that were affecting her health, but her health issue, but her food issues that were affecting her health. So that's a little bit about us, and I'm going to turn it over to Lila.
Thanks, Carla. My name is Lila Fleishman, coming to you from Bozeman, Montana, realizing that those contact slides are really helpful for a webinar with such large reach. Bozeman, Montana is a small city in a rural part of Montana in southwest Montana. Bozeman itself is right around that 50,000 mark, which the new census, hopefully everyone will take it, will give us some more information on. As you can imagine, in Montana we have a cold winter climate. Bozeman is also a city that frequently comes up in the high quality of life measures, which leads to really dramatic affordability issues all along the housing continuum. I think our most recent numbers for single-family homes, the median sales price is over $500,000, and that just puts more and more demand on all demand for housing. So HRDC is a community action agency that works in Southwest Montana and Bozeman, Montana. I am here to talk about how housing is health care. So it's, as we just learned in Sarah's presentation and Carla's, that quality is really important. But before we can get to quality, considering people experiencing homelessness without access to housing at all are having really detrimental impacts on their health. So we know that people experiencing homelessness have much higher rates of all kinds of illness. Living outside or in congregate shelters, especially during a pandemic, is really a detrimental, a stressful lifestyle, and that it's difficult to maintain a healthy lifestyle. It's also really difficult to follow through with good healthcare practices. So if you think of the last time you were recovering from an illness or maybe a minor surgery, being in your house is really an important, or apartment or whatever dwelling, is a really important way that people are able to start that process of healing. So we're really considering the impacts of health on a population that is both more likely to have health complications, and then also experiencing homelessness leads to negative health outcomes. We believe that homelessness should be rare, brief, and non-reoccurring. And one of the ways that we and our community partners are trying to get to the root of this, the root of these problems and really change those health outcomes is through the FUSE initiative. So there's a lot of definitions of this that I'll go through later in the presentation, but what's at the core here is that the FUSE initiative dives into data to explore the relationship between homelessness and health outcomes with a goal of implementing evidence-based solutions, including permanent supportive housing. One of the key outcomes is to build a case that housing is healthcare, like the conversation we're having today. We aim to better understand the problems so that we can build more impactful solutions. FUSE stands for Frequent User System Engagement. So it's a type of corporation for supportive housing. Created this model to break the primary utilization cycle of high-cost crisis services in communities by increasing housing stability for vulnerable people through evidence-based strategies. And this likely sounds familiar to many people on the call. This is a national initiative. Bozeman is one of all of the communities across Montana that is implementing this, as well as places across the country. So we began our initiative in 2019. This slide provides kind of a high-level roadmap of what FUSE looks like. So the planning stage is considering which stakeholders to bring to the table, who needs to be included, where are emergency services located that people experiencing homelessness are using, how do you get them all to the table, and then define what a frequent user means, create a system to share that data and understand what that landscape looks like. From there, the pilot implementation moves on to identifying where to house this population and what kinds of existing services are already in the community that could be applied. And then piloting, starting there to pilot what is available to show what other communities have found that individuals that have experienced particularly chronic homelessness with a lot of other health conditions are more likely to remain stably housed if provided with this opportunity. So from there, scaling. The outcome being permanent supportive housing, and to define that and make sure that everyone is on the same page about what that includes, is that this is a housing first approach. So there are no, you don't have to pass any sort of test to get this. This is using housing as a tool for increasing health outcomes. The resident will sign a lease like any other kind of housing. They have the right to tenancy. The services are catered to what the individual may need and are flexible. There's no mandatory requirements to participate. And then they're separate from being able to stay in housing. So there's no threshold for completion or contacts to services to keep the housing. So where Bozeman is specifically in this process is that last year we completed our year one. So in addition to a huge thank you to rural LISC for helping add capacity and create my position and expand our healthy housing work in general. A Montana Healthcare Foundation has been really great in bringing together partners and working with Corporation for Supportive Housing across Montana. So we were able to bring the typical local partners. For us, that looked like our local emergency department. We have one hospital right now. We're getting a second, but right now there's the one, Gallatin Detention Center, and then HRDC is the main housing provider in Bozeman. So those are the core for identifying what the frequent user is, and then we have partners that also focus on the behavioral and physical health aspects, as well as the city and county corrections, to look at how to really better address using, how to identify the population so that we can better address for housing. What we found in that first year, again, wanted to highlight the size of Bozeman. This work is done all across the country and looks really different in places like Los Angeles and Denver. I'm currently undergoing the second match, but in the first year, we found 23 individuals that met this, what we defined as a frequent user. So looking at that, it's pretty inspiring to the idea that we could really create significant change and improve the outcomes for these individuals. Because we're a small community, these are definitely familiar faces to those of us that are doing this work. One of the key parts of Fuse is to also consider, as a community, how are we paying for very poor outcomes, and how could we measure and quantify what we are paying and that shared cost to consider how to think of something different that's going to have improved health outcomes. So our per person calculation was a pretty rough estimate using what we defined as our frequent users, and this is pretty consistent with what other similar initiatives have found, of about $27,000 per person. We'll be redoing that and having that data coming out pretty soon, so that'll be helpful to see. And that really sets a baseline for us to measure our success once we are able to move on to this next phase. So right now we're in the process of identifying target numbers of individuals from our Fuse list that we would like to be able to provide housing to, obviously to everyone, but how to prioritize, and then connect to those wraparound optional support services. So one of the places that we intend to start is that HRDC has a handful of buildings that we operate for rentals, including some recent preservation projects, and those will be more of a scattered site approach. The other exciting project that we have going on related to our Healthy Housing initiative is, for the past about 5 years, HRDC has been working with community partners on a vision of collaboration around building a trauma-informed tiny home community. And this is really incorporating a lot of those physical healthy housing pieces that we were discussing earlier in the presentation, where one of our partners is the University of Montana School of Architecture, and they were able to build a structure that is code compliant and then have a instructor live in the unit for some time and conduct some livability tests. So really looking at this village from a holistic healthy housing perspective of what is socially healthy and what is physically healthy and what that environment can do. So green space, walkable, the indoor air quality, really significant. In 2019, HRDC was selected as a Fannie Mae Sustainable Communities Innovation Challenge grantee, and with that, or not grantee, a contract awardee, sorry. With being a contract awardee, we have a partnership with the Urban Institute, who will be releasing a report on the first part of that next month. I don't have a link to it, but that could be something to keep a lookout for. And one of the largest challenges of this development is that finding land for this kind of project has been a huge challenge. So we are really excited that just a little bit less than a month ago, we were able to purchase land, and we plan to have people moving in by next summer. So especially during the pandemic, we're really excited about where this work is leading us and the health outcomes for residents that will be living in the village. I did want to highlight that there will not be a one-to-one. The Fuse list will have options of places around the community, and that not everybody living in the village will be from the Fuse list. So these are the choice is still a key element. Anyhow, I'm going to turn it back over to our host, but thank you for your time and attention, and I think we have some time for questions.
Yes, this is Vicki again, and thank you to all the presenters today. We do have a couple of questions that have came in, and so this is the time. If you have any questions, please type them into the question and answer on the right-hand side of your screen. The first question is, what specifically is your organization doing in response to the COVID-19 pandemic and other current civil unrest issues?
I think that question can actually be posed to each of our panelists. So let's start alphabetically with Andy, then move to Carla, and then Lila and Sarah if folks have responses.
Okay, this is Andy. So we have been focusing primarily on small business assistance, and with funder-driven initiatives, we have been able to do some things for nonprofits in different markets. But nationally, we've been raising funds from Verizon, Lowe's, and several other businesses to do small business grants. We're doing PPP loans for businesses. In a few markets, we've been able to do some funding for nonprofits. Thanks to Walton Family Foundation, we're in the middle of making 45 $10,000 grants to nonprofits in the Mississippi Delta area and in the northwest part of the state. And our development team's been working nonstop to be able to do similar initiatives in different parts of the country. But basically, we've had this rapid response on the economic development side.
This is Carla. Because we go directly into homes with our weatherization and healthy homes, we had 1 month that we did not go into homes. That was the month of April. Starting back May 4th, we are going back into homes. Basically, we do a survey with a family prior to leaving that morning for the home, just asking, how their health is, if they've had anyone in their family sick. And then when we go in, we ask them to wear a mask. Of course, our crew have all of the personal protective equipment. We do ask that while we're in the house doing work, if they would stay in a room away from where we are, and if they need to leave, we just simply step out of the home if they have to do something in another part of the house. When we first went back on May 4th, we had a number of people who didn't want someone else in their home, and we completely understood that. But we are now not seeing that. We're in Missouri, and our case numbers are spiking, but we're still not seeing people not wanting us in their home. So that's what we're doing in light of COVID-19.
Thank you. Sarah, did you see the other question? Okay, so we do have a question, and this question would be, How do you gather, it's from Michael from Kentucky, how do you gather your homeless data? He says that they don't have a mechanism, and many people don't want to be identified as homeless, and they need to find their baseline to measure progress.
Great question. I assume that's for me. This is Lila. So we had the homeless data we collected from our local coordinated entry, as well as HRDC operates a lot of services, including a seasonal warming center. So we had, we approached the frequent user list of looking at who met all of the requirements of staying at, either had stayed at the warming center or was in our coordinated entry system with a VI SPDAT score. So that means that they had interacted with one of our partners and identified as homeless. And then our coordinated entry system has the data on are they experiencing chronic homelessness based on the HUD definition or not. But without that work that had already been done, it would have taken a lot longer to get to that data match. And that being said, it still took us about a year to work with getting health data from the hospital, where they, for good reason, are really protective of that personal information. It still took a lot of time, but having the coordinated entry data was a really necessary component. Thank you.
Thank you. Does anyone have anything or presenters have anything they would like to add to that? Okay, we're moving on to the next question. This is from Jean. Karla, this would be for you, and it's for healthy homes. How many air changes per hour do you try to reach?
And I'm not the technical person, Jean, so I will find that answer and get back to you. My weatherization healthy homes people could tell you that immediately. I always confess that I can't, so I will find that and get back and let you know that.
Great. We can relate to that. Okay, so we have another question here, and the question would be, are there strategies or other best practices for approaching healthcare funders for support that you could share?
This is Karla. I can tell you what we've been doing with the healthcare system. We had a pilot Healthy Homes program with one of our large hospitals in St. Louis. We have counties that border St. Louis County, and it was we did about 10 families. I think we ended up doing about 15 families, and we partnered with this hospital, our sister community action agency in St. Louis County, and then ourselves. And we did a pilot, as I said, and from that pilot, we have reached out to United Healthcare, and we are working with them. They have asked for a proposal from us. They had their chief medical officer and their chief financial officer out of St. Louis come out and see a home being worked on. We're really impressed. And so we're continuing to work to get them to fund a Healthy Homes program. You know, with COVID, what we said was that we're being asked to shelter in place in homes that make us sick. And so how important it is that healthcare begin to recognize that and reach out. So those are the things that we have worked on and are working on.
Right, those are good tips for folks. We do have another question. It's from Erleen. This is for Lila. And with regards to the tiny houses, how were you able to get localities to accept the concept zoning?
Great question. So we actually have been, we work with the city on a lot of projects, so we have ongoing relationships as an affordable housing developer. And one of the ways that we have gotten, well, it's not approved yet, but one of the ways that we think that we will be successful is that my colleagues prior to me joining worked with the city to adopt a transitional and emergency housing ordinance, specifically to define that an administrative approval for knowing that this is where we wanted to go. So I think about 3 years ago, we worked with the city to get that approved and lay the groundwork. The other key part is that these homes are fully building code compliant. So they're small, but they don't require exceptions in that they're mobile or something of that nature. So I think that if you would like to email me, I can send you an example of what the Bozeman ordinance looks like. But that, yeah, complicated issue. Thanks.
Probably ongoing, so yes. So with that, there are no other questions for us for the panelists today. And that being said, is our goal today was to provide you with an important information and resources revolving around healthy houses. And I would like to say a special thanks to Sarah, Andy, Karla, Tim, and Lila for the wealth of information shared today, as well as each of you for your time and participation during today's webinar.